Okay, so let's talk about what my nurse practitioner Amy does on my team. She's gonna come make an appearance for just a second.
Hello.
She doesn't like to be on camera, so I'm just gonna tell you what she does because she did not want to tell you herself. Okay, so Amy, the nurse practitioner who works with me on my team, helps me with post-op care primarily. So she is who my patients are hooked up with on our encrypted texting system the day of their surgery, and then they have kind of a direct line to her for the first month after surgery, so they can ask her all of the questions that come up in the post-operative period. So Amy works at home most days because she takes calls and answers questions on Clara from my patients, and she comes into the office on my 2 clinic days. So during clinic, which is today is a clinic day for me, she's here with me and she comes into all of the post-op appointments with me. So since she's been in direct communication with all of my patients, she keeps me up to date with all of the concerns, everything that's going on with them. So she really just helps me take better care of my patients. Now, although Amy doesn't work full-time in our med spa and do lasers all day and Botox and filler and scar treatments, she does a lot of that for my patients too. So she will come in and do treatments on patients, and she has some patients of her own, but her primary job is helping me with post-op care of my patients. Now, I learned something bringing Amy on to help me. So before I had Amy, I would take all my own calls, and I rarely got called at night or on weekends. And I thought it was just because I'm awesome and I'm good at educating and my patients didn't have questions. Turns out they did have questions. People just commonly are a little intimidated to call their physicians. They don't want to bother us at night or on weekends. And if it's not a big concern, they don't want to bug us. But they have a concern. And so when Amy started taking calls and answering my messages during the day when I'm in the OR, the volume of messages went up. And I learned that fact that patients are more comfortable bringing things to her than they were to me. And I think it's just awesome because now my patients are much more comfortable. And I always tell people anxiety is the enemy of healing. Even if it's a minor concern, it can morph into a major concern if it's not addressed. So I think this is a really cool job in nursing. It's very flexible. You get to do some of your work from home, which is not always able to be done for nursing jobs. And it's just really cool. My patients love her, like absolutely adore her. And like I said, I think that they get better care with her as part of my team. And the other thing is she helps me be better in my education up front. So I learned things talking to Amy about what patients' concerns are and how to better take care of them when it comes to dressings and wound care and everything else. And I think we all just get better as a team. So it's an awesome collaboration. I love having a nurse practitioner on my team. So currently, the way it works in my office, the medical team is myself, I have a PA, I have my nurse practitioner Amy, and I have an MA on my team, and it's awesome. And then one more thing I forgot to mention is, what do you have to do to get a job like this? So it's just not appropriate for most nurse practitioners. To be frank, you really need to have a really good understanding of surgical care, post-surgical care. So there's not like a surgical nurse practitioner, and what I'm looking for is someone who's had really good experience taking care of surgical patients. So in general, ICU, ER, surgical floor, I think those are the most important things, and I want multiple years of that because I need someone who's got chops, so to speak. New grads, it's not the best job for a new grad. Amy was a new grad, but she's super special, and I knew it when I met her. But in general, I think having a couple years under your belt is really important because, surgical patients are complicated, and it is acute care, and it's important you really know your stuff.